November is celebrated as Diabetes Awareness Month. World Diabetes Day held annually on November 14 to bring attention to the disease, to educate people about the impacts of diabetes on human health. This day is observed on over 160 different countries and by more than 230 member Association of International Diabetes Federation. It is marked on 14 November on the day of Sir Frederick Banting, who discovered insulin along with Charles Best in 1922. This Diabetes Day is also more important because insulin has completed its 100 years. Diabetes Day theme for 2021 is Access to Diabetes Care, if not now, when? 1 in 10 people around the globe have diabetes. A century after its discovery, insulin and other fundamental components of diabetes care who remain beyond the reach of millions who need them. Without treatment or sufficient support, people with diabetes are at risk of serious and life-threatening complications, including heart attack, stroke, kidney failure, blindness, and lower limb amputation. Diabetes is the general name given to the range of diseases which include type 1 and type 2 diabetes, gestational diabetes, diabetes insipidus. Diabetes impact how pancreas releases insulin, a hormone used to balance sugar levels in the bloodstream. Number of health concerns and complications that can arise from diabetes include various vascular problems, conditions of eyes and feet. Modern medicines control diabetes using diet, weight loss, and insulin replacement therapy. Understanding diabetes. Diabetes put people at risk of nerve damage, cardiovascular disease, foot and limb injuries, visionary problems, and other complications that arise from having uncontrolled blood sugar. Diabetes raises a person's risk of developing serious COVID-19 symptoms. That's why understanding and managing is more important now. Diabetes mellitus is actually a group of metabolic disorders that cause your blood sugar levels to be higher than it should be, therefore prevent your body from using energy. Coming to the types of diabetes, type 1 diabetes is an autoimmune disorder that begins before adulthood, in which the immune system destroys cells within the body that make insulin. Type 2 diabetes is a disease that usually begins in middle age, which results when body is not able to use insulin properly to regulate blood sugar. Gestational diabetes is similar to type 2 diabetes, a condition that occurs during pregnancy. There is a question, why we need Diabetes Awareness Month? Did you know that more than 1 in 5 people in US who has diabetes does not even know that they have it? According to the American Diabetes Association, that's 7.3 million people out of total 34.2 million who are not aware they are living with disease and all the other risk factors. According to the Pakistan Endocrine Society, overall diabetes prevalence in Pakistan is 19% and over 522 million people who are currently living with diabetes globally. No wonder an awareness month is needed for diabetes. Pakistan ranks third in the prevalence of diabetes, following China and India, while it was on 7 in 2020, just a year ago. According to the IDF, around 33 million people are living with diabetes in the country. As per IDF, in 2019, around 19.4 million were diabetics in Pakistan, but within last 2 years, when most of the physical activities came to halt due to pandemic, 13.6 million more people have become diabetics in the country now, which is an extremely alarming condition. Pakistan is now ahead of US, which has 32 million diabetics in population of 330 million people. Buckeye Institute of Diabetology and Endocrinology, Karachi, and Health Research Advisory Board mentioned that a similar number of people in Pakistan had borderline diabetes, and if immediate actions was not taken, the number of diabetics could be doubled in the country soon. The Memorandum of Understanding was signed between the Health Research Advisory Board and a local pharmaceutical firm for the creation of Diabetes Registry of Pakistan for people with type 2 diabetes, diabetic foot ulcers, peripheral vascular disease, and women with gestational diabetes. Number used in diagnosis of diabetes are even more important than knowing its stats. You could be diagnosed with the disease if your fasting blood sugar level is 126 mg per dl or high.